Greetings from Human Biological Institute. Welcome to another engaging session of our scientific forum, Immunize with Pride. At Human Biological Institute, HBI, a division of Indian Immunologicals Limited, we take great pride in driving public health awareness through our unique initiative, Immunize with Pride, dedicated to educating people with vaccine preventable diseases and the importance of timely vaccination. This platform offers accurate, expert based information on immunization across all stages of life, that is, from infancy to adulthood, emphasizing that vaccination protects not just individuals but entire communities. Our session features leading health experts who share valuable insights to promote awareness and strengthen community well being. We also bring you the Immunization Conclave, a platform that unites experts to discuss vaccines, preventive health, and the power of accurate information in building a healthier society. So today we are delighted to have Dr. Rajat Agrawal from Delhi, Dr. Gaurav Garg from Bathinda, Dr. Sharma Sharma from Kolkata with us to share their expert perspective on a very interesting topic, the need of hepatitis vaccination. I shall be sharing more about our today's speaker and will be coming into discussion in a short while. For the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited, which is a One Health company. IL was established by National Dairy Development Board in 1982 as its unit and later registered as a company in 1999 with the name of Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first varicocele culture rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we're the major player of human vaccines in India. HBI is a leader in ARV segment and present in around 60 countries. With a vision of shaping global healthcare by spearheading One Health initiative, with a mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customer needs. IL believe in corporate social responsibility, and in that, IL has adopted two government schools in the vicinity of Kargapatla facility, their manufacturing facility at Hyderabad. With the help of Gift of Milk program, where IL is reaching out to 2,500 school-going girl children in Tamil Nadu and Telangana and providing milk every day. IL has also donated oxygen generation plant to teams in Gachibowli, that is in Hyderabad. To know more about Human Biological Institute and Indian Immunologicals Limited, visit www.indimmune.com and follow us on the social media links. India faces a huge burden of viral hepatitis with around 29 million people living in hepatitis B and 5.5 million with hepatitis C. Chronic hepatitis B infection, which is affecting 2.4% of the population, while hepatitis C rates are very regionally. Despite effective vaccines, also we are seeing several outbreaks with hepatitis A, which is again a communicable disease which spreads through contamination of food and water. Despite effective vaccines, many remain unvaccinated, leading to preventive cases of liver cirrhosis and cancer. Wide vaccination coverage is crucial to curb transmission and protect future generation. As a part of this endeavor, we are pleased to have Dr. Rajat Agrawal, Dr. Gaurav Garg, and Dr. Saurav Sharma with us to discuss on the need of hepatitis vaccination, which is a vital step in protecting individuals and communities from a preventable liver infection. So it is my privilege to introduce our panelists today. Dr. Rajat Agrawal, we are honored to have with us Dr. Rajat Agrawal today. So welcome, Dr. Rajat Agrawal, a highly accomplished consultant, child specialist with over 21 years of experience in pediatrics and child health. He holds MBBS, DCH, DNB, MNAMS Pediatrics, an MBA from FMS and MRCPCH from London. Dr. Rajat currently serves as the Secretary of North Delhi Indian Academy of Pediatrics and is deeply committed to advancing pediatric care and immunization awareness. Welcome, Dr. Rajat. It's a privilege to have with you. We are delighted to welcome Dr. Gaurav Garg, Delighted to welcome Dr. Gaurav Garg, a highly experienced consultant, pediatrician, and neonatologist with over 15 years of clinical experience. He holds an MD in pediatrics and completed his IAP fellowship in neonatology from KEM Hospital. Dr. Gaurav is currently associated with Max Hospital and Mediprime Hospital in Bathinda, where he is known for his dedication to newborn and child health. Welcome, Dr. Gaurav. It's wonderful to have you with us. We are delighted to welcome Dr. Saurav Sharma. Dr. Saurav Sharma from is a highly qualified consultant, child specialist with vast experience in pediatric and neonatal care. He holds MBBS, MD, DNB, MRCPH, PGN, PN, and IPPN, reflecting his deep commitment to continuous and medical education. Dr. Sharma is well recognized for his compassionate care and active role in promoting child health and immunization awareness. Welcome, Dr. Sharma. It's a pleasure to have you with us. Now, so welcome, Dr. Rajat, Dr. Gaurav.
Thank you.
Thank you very much.
Yes. So we have Dr. Saurav. Now, yes, Dr. Saurav is yes. So thank you, Dr. Rajat, Dr. Gaurav, and Dr. Saurav for joining us today as we talk about a very relevant and timely topic, that is hepatitis vaccination and its need, why it is needed in today's world where preventive healthcare is gaining importance. Understanding how this vaccination plays a role in basically both childhood, adolescence, and adult. So let us begin the discussion. So my first question, before we begin, it is important to understand the basics. So many people have heard the term hepatitis, but may not know what it exactly means and why it is so dangerous. So my question to Dr. Gaurav, what exactly is hepatitis and why it is considered as such a serious global health concern?
Good afternoon, friends. As the name suggests, hepatitis, it's an infection of the liver. So, hepatitis is a very dreadful disease because a major organ of the body is affected of our body, and it in India we basically deal with five types of hepatitis, that is A, B, C, D, and E. In children, we mostly see hepatitis A, whereas in adults the major prevalence is with the hepatitis B and C. In hepatitis, basically, as I said, the liver gets infected, so we get fatigue, we get yellow discoloration of the body and the eyes, and feeling of nausea, pain abdomen, and feeling of vomiting. And it is a serious issue, and it can further lead to acute liver failure, and if it is not treated well, can lead to chronic liver failure also.
Dr. Rajat, could you please share something about how many types of hepatitis are there and which are really very serious and it affects us?
So, as Dr. Gaurav has said, we have five types of hepatitis serotypes which are circulating. So, they are mainly A, B, C, sometimes D, but it is very difficult to detect, and E. So, the major circulating strain which comes in our practice are A and E. However, the B and C, they are more in the adult population form, and A and B, they are most commonly preventable by using the vaccination. So, These are the 5 types which are currently causing the hepatitis.
Is it a global problem? Like, is it only
So,
restricted to India
so
or
it is
across?
a very, it has a very good, the disease has a very global high burden. So, but the vaccination, improved vaccination with the universal immunization programs and with the availability of many hepatitis A vaccines, there has been a significant decline in the number of cases which we see as compared to the past. However, in the adults, there are significant cases of B and C, which we readily see because of poor sanitation. There are cases of A and E, which are more in the developing countries. They are not more seen in the advanced or the developed world. So hygiene is one of the factor which is contributing towards the A and E uh, viruses.
So, doctor, is it like how the burden of hepatitis evolved in India over the years? Do you see that there is increased number of cases, or is there any epidemiological shift that has happened from the children and adults are getting more affected in any kind of hepatitis?
So yeah, India has made a significant progress in controlling hepatitis by using the universal immunization programs, in which the hepatitis B vaccine is being given to all the babies who are born in whatever setup. Even in the government setup, they are being given. And there are major availability of a hepatitis A vaccine. There is more increased knowledge amongst the patients regarding the availability of vaccines. And hepatitis A vaccine is being given to the adults also, to the children who come to the pediatrician. Also, however, there is an increased burden of C and B, which is in the adult population, and migration might be affecting the spread of the disease in B or A. However, there are millions of undiagnosed cases who are spreading the disease, like B and C. They have a different mode of spread. So the global burden has significantly decreased, but however, the problem still persists.
Now, knowing how a disease spread is the first step to prevent it. Now, hepatitis A and B have been are very common, and hepatitis A, B different modes of transmission. So, my question to Dr. Saurav would be, how do hepatitis A and hepatitis B spread from person to person?
Good afternoon, everyone. As we are talking about hepatitis, so one of the important things is to know how exactly do they spread. So, talking about hepatitis A usually transmits through fecal-oral route. That is, in case if someone is consuming some contaminated food or contaminated water, in that case they can get hepatitis, or they do not wash their hand before consuming a properly cooked food, or in case the food is undercooked. In that case, usually because of this, fecal-oral route transmission of hepatitis A can happen. Whereas hepatitis B is the other way. Hepatitis B does not occur through fecal-oral route. Hepatitis B transmission usually happens through the parenteral route. So that is mainly concerned about the blood route or other body fluids route. So, in case of blood, it can be transmitted by using any blood product which was already contaminated with hepatitis B virus, or in case of sharing needles or tattoo syringes among people among which one of them was suffering from hepatitis B, or it can also be transmitted through other body fluids like during any unprotected sexual intercourse, and it can also be transmitted vertically from the mother to the baby.
Okay, so one is transmitted through contaminated food and water, other is transmitted to the body fluids. So that's great. Dr. Gaurav, could you please share what are the other, like hepatitis C and hepatitis E virus, and how they get transmitted, and how common are these viruses in India?
So hepatitis C, as Dr. Rajat also said, it's basically it spreads through blood. So the drug addicts, some wrong blood transfusion, or through sexual intercourse, hepatitis C and E can spread. And hepatitis C, being because it is at present we don't have a vaccine for hepatitis C and E, so that's why they are coming more into the picture and creating a problem for the people.
So how did it spread, like hepatitis E? How hepatitis E spreads?
Hepatitis E also spreads to this blood only.
Okay, okay. So that means A and C are a similar way of transmission, while B and
From
E.
B and C. A is the fecal-oral route.
Yes.
Whereas B and C and E, they all spread through blood.
Okay. Okay. Thank you. Doctor, I think would like to ask Doctor Rajat. Liver diseases have many causes. Not all are viral. Some things are related, crucial to the proper diagnosis and treatment. Why it is important to differentiate between a viral hepatitis and other liver disorder?
So what we have seen that the viral hepatitis, they mimic many other liver diseases. They mimic like viral hepatitis. So there are different diseases of liver which are like drug-induced hepatitis, which is very common in patients. We start with ATT or with certain drugs. So they come with the liver toxicity. There are many autoimmune disorders which we see. Then one of the major causes in adults is alcoholic liver diseases. So it is very important to differentiate by using the proper lab diagnostic test. So we can order the serology, the LFTs, and then we can look for the antibodies, and we can make a diagnosis because every treatment, like for the autoimmune, the treatment is different. For the viral hepatitis, the treatment is different. For alcoholic liver disease, the treatment is different. And for drug-induced hepatitis, we have to stop the ATT and restart again. So the treatment, it depends on which uh, problem is. So we have to look into the specific diagnosis. In the cases of viral hepatitis, we have to do detailed testing and then manage accordingly.
Right. So there are proper tests available for all these viruses for
Yeah.
hepatitis to understand and diagnose. That's fab. That's great. Now, Dr. Saurav, can someone who already have hepatitis A and B still take the vaccine?
In case if it is a proven case of hepatitis A, I'll talk about hepatitis A first, then hepatitis B. So, in case if someone is proven to have suffered from hepatitis A, lab proven, in that case, usually hepatitis A confers lifelong immunity. So, after someone who has suffered from hepatitis A, it does not make sense to give any vaccine because they already have got lifelong immunity. There's no harm as such in vaccinating the baby, but there is no point giving the vaccine because they've already been immunized naturally. Whereas in case of hepatitis B is known for chronic carrier stage and even turning into be hepatocellular carcinoma and all. So in those cases, it's better to get the serology done. In case if we see HBsAg, that is the antigen which is present, so in that case the patient is already having any active infection. In that case, we do not give any vaccine. And in case if the antibody to this HBs is present, that means they are already having the immunity. In that case also, you need not vaccinate. But in case both of these are negative, that is antigen and antibody, such patients are likely to are susceptible to the infection. In these cases, we can go for fresh immunization.
Great. So that being very clear that yes, once with hepatitis A, if anybody is infected, definitely they
Yeah,
will.
but for hepatitis A, what is more important, you need to be sure that that
Yes.
was a lab proven hepatitis A itself, because hepatitis
Yes.
many a times it can mimic other diseases also. So you need to be sure that particular episode of hepatitis was caused because of hepatitis A virus.
Yes. So that becomes very good, gives a clarity. Like we often get misguided by the symptoms and we feel that it's hepatitis A,
Yes.
but it may not be hepatitis A.
Yeah, so unless you prove it by lab test, it should be proved ideally.
Now, hepatitis can often go unnoticed until it becomes serious. So, recognizing early sign is a key for early treatment. So, what are the early warning signs and symptoms that people can watch out for? I think Dr. Gaurav, could you please answer this?
So, if a child presents to us with repeated episodes of vomiting and pain in abdomen, and mild child may be having fever, uh, we normally think as it may be something like gastritis or some acute gastroenteritis. Until and unless we see the icterus or yellow coloration of the eyes, we hardly suspect hepatitis. Or and if it is palpable the liver and if it is little bit palpable, we may think. But until and unless the symptoms are repeating and the child is not improving, he is having loss of appetite, he is not able to swallow anything, and then we check for
Uh,
the, and if you see PGPN and the child is looking yellow, the eyes are looking yellow, and the stool color is becoming white, we suspect that it may be hepatitis.
So, yellowing of the skin, yellowing of the eye color, and the yellow of the stool, as well as you said something like loss of appetite. That means these are the signs where we people look definitely go and seek a doctor's advice, right? So now coming to the next, like if this hepatitis remains unnoticed and it remains untreated, this can silently damage the liver over time. So, what are the long-term complications if hepatitis remain undiagnosed and untreated? So, this is to Dr. Rajat. Dr. Rajat, could you please share?
So, untreated chronic hepatitis, it can progress into fibrosis first, then it can lead to cirrhosis, liver failure, and finally hepatocellular carcinoma. So, these complications they silently develop over a period of time. So, we need to recognize these complications well in time, so and treat accordingly, so as to save the child life or the adult life, and to save the patient from liver transplantation, which might be needed later on, and which is one of the thing which is very much costly these days. And early intervention can prevent this liver transplantation, which is the ultimate treatment for this.
Uh, so, you suggest liver transplantation as a early, uh,
No, 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 no. I suggest early diagnosis.
yeah.
Like after hepatitis, there is a chances the patient will progress into fibrosis. Then next stage would be cirrhosis. Then there would be liver failure. Then there would be hepatocellular carcinoma. So we have to identify the patient before he develops into liver cirrhosis, so as to treat him accordingly. After cirrhosis happened, then the ultimate treatment is liver transplantation. So we have to diagnose early and treat accordingly.
So,
Medical
doctor,
therapy can be
what is
provided.
that early stage of diagnosis? How people, I mean, how
So
we
in
should,
case of alcoholic liver diseases, the patient they usually delay seeking treatment. So they
okay.
come when the complications arises. So what I see, because I sometimes see the adult patients also, so they come with belly full. They have ascites and they have yellow icterus. So they come and they have then portal hypertension. They bleed everywhere. So it is the time when they should have seek the medical intervention earlier on. But this is not the complicated case. So, in cases of alcoholic liver diseases or in drug induced hepatitis, the patients fail to recognize that we need to get to the medical facility at early to prevent the complications. So, the symptoms should be watched for, and patient education should be done to prevent the complications.
Okay. Now, doctor, when people come for the vaccination during the childhood or adolescent or what stage of hepatitis vaccination is
So
done?
usually patient they come at the birth we immunize, then they come for at 1 year, and in missed cases they come after 2 years. When they want some college admission, then sometimes they want to go to the foreign university, then they come for the vaccination. These are the main
So,
incidences when they come for the vaccination.
so how many doses or how often a person can come for this hepatitis vaccination?
So there are two types of vaccinations which are available for hepatitis A, and single type for hepatitis B. So for hepatitis A, we have an option of providing a live vaccine which can be immunized after the age of 1 year in a single dose, and the other would be the killed vaccine, then which is given in the two doses form 6 months apart. It can be given after the age of 1 years, and after the age of 2 years, we have different kind of adult vaccine which is available. However, not very much frequently available these days because only one or two companies are making it. And in the college time, we usually give one vaccine so that we can save the time of the child because they want to go for the university admission. So we give live vaccine in the young or the adolescent or the teen.
Okay. Now, doctor, this question will be to Dr. Saurav. Why should adults, not children, consider hepatitis vaccination, especially in high risk groups? So, let us discuss both the perspective of hepatitis B and hepatitis A.
So, as I said, that hepatitis A can be transmitted to through fecal-oral route. So it's not like only kids will be spreading it. it can be spread through anyone's feces, and in case if it is contaminated, so that care should be taken by child as well as adults. So even adults can pass the virus through their stool, so even adults need to be vaccinated. And for breaking the cycle of ongoing transmission, we need to stop it at all the levels. Only then we can have someone not suffering from hepatitis A. And similarly for hepatitis B, it's about all the body fluids. So even adults can suffer, and even adults can transmit hepatitis virus. So it's not only about vaccinating the kids, it's even adults who needs the vaccination, so that we can stop this transmission of hepatitis A as well as hepatitis B.
So for hepatitis B, if somebody has taken in the childhood 3 doses, or in the adolescent days, the person has taken or 2 or 3 doses. So
Hmm.
what should be the vaccination schedule in adult? Do they require vaccination in adult stage? All
No, ideally, in such cases, we do serology first. We
okay.
look at the antibody levels. In case if it is less, then the ideal way is to go for vaccination again. In case if they have sufficient amount of antibodies, then there's no need of vaccinating. Like before joining any medical field or something which is considered to be a high risk for hepatitis B transmission, we always check for serology. In case if they have sufficient antibodies, then there's no need of vaccinating. But in case if we feel that antibodies are lacking, it's always preferable to vaccinate them again.
Yes, that's great. So we have to diagnose and then go for the
Yeah,
treatment.
first we do the serology and then proceed with the vaccination.
Dr. Gaurav, could you please tell me why hepatitis is called as a silent disease?
So it's called a silent disease was because sometimes we don't know that the child is having hepatitis, and we don't diagnose it early. And as the child is not having any symptoms, he's having a normal life. But gradually, once like he comes with a huge stomach or a pain in the tummy, and we see that his liver is already half gone. So sometimes hepatitis don't present in early stage, and we sometimes find that the child is already having acute liver failure or maybe chronic, and having cirrhosis in later on in his adult age. So hepatitis can present as a silent disease, being not showing any symptom initially.
Okay, so that means most of the people will not show symptoms, but still they will carry the virus, and
It
it can.
mostly happens in hepatitis B cases.
Okay, okay,
Yeah.
okay. Dr. Rajat, could you please now tell us what should be the adult vaccination doses for hepatitis B and A, and what if people have not taken the adolescent during adolescent? What is the catch-up vaccination schedule, and are the vaccines available safe for patients? Yes.
Yeah, the vaccines are completely safe, and people should trust and get them vaccinated. Hepatitis B, it has a very simple schedule of 0, 2, and 6 months,
3 doses, right?
irrespective of 3 doses, irrespective of whether they have immunized. However, in the cases of doubtful, we can check for the hepatitis B titers in the blood. If they are below a significant range, then we can immunize completely. And for the hepatitis A, a single live dose or 2 doses 6 months apart in the killed can be given in hepatitis A.
So now, my next question, since we have discussed about the vaccination schedule and the prevention, and vaccine is very safe for the public. Now, let us understand hepatitis elimination in India. There is a strategic goal for the government of India to make hepatitis free India. So, how do you think the future of hepatitis elimination in India, and can this vaccine makes it reality? And if at all it can make reality, what could be the future? I mean, the policies, or maybe the strategies to be taken to ensure that vaccine reaches and everybody take vaccination. So, this is for Dr. Shaura, please.
Yeah, a vaccine is going to be a very important factor in such cases, because if we want to eliminate the disease, we need to look out for stopping any further infection. Because once we stop further infection, only then we can stop the further transmission. So in that cases, vaccine is a very important thing, so that someone, even if they are exposed to the virus, they should not contaminate with the disease, and they should not spread the virus further on. So which is a very important break in the transmission of the disease.
Okay. Now the question to Dr. Gaurav. Dr. Gaurav, as Dr. Saurav said, that is vaccine being a most cost-effective tool. So why do you feel that it is only the cost-effective tool? There is no other way for hepatitis A and B? Like what would be the treatment cost to the patient or the people once get infected with hepatitis A and B? How the life of the person would be after get infected?
So see, definitely we should always try to prevent ourselves than to get contaminated. So a person should definitely take immunization, but suppose the person is not has not taken a vaccine, he should have a good diet so that he should not get hepatitis A through fecal-oral route. And suppose he gets and he gets infected and he gets hospitalized, definitely the burden of the treatment and hospitalization will be more. So, the in nutshell, it's always better to take a vaccine and get prevented from such a dreadful disease. And the vaccine cost is also not so much that a person cannot afford. So, it is advisable that hepatitis A vaccine should be taken by all children, and by default, hepatitis B government is giving. So, at least they are protected from hepatitis B, which was too once upon a time a dreadful disease. Yes.
And moreover, doctor, it is now probably affordable. The vaccine is definitely affordable. If we see the cost of the treatment and the future of hospitalization and the trauma and the morbidity situation with the patient has to face once the disease occurs. So probably it is yes. When we see the various options, so vaccines becomes definitely a very cost-effective tool for prevention. Now, people with existing health conditions like diabetes and liver disease may need extra protection with through vaccination. So, what would be your advice for patients with chronic illness like diabetes, people with chronic liver diseases with hepatitis vaccination? Now, Dr. Rajat, could you please enlighten
So
us?
individuals with the chronic diseases like diabetes or CKD, chronic kidney diseases, or some existing liver diseases, they are at very high risk of hepatitis, catching hepatitis A, B, and E virus. So it would be a very important decision by their routine physician to get them immunized so that these complications don't occur, because the disease has already debilitated their body and the immunity is less, so they are very much prone to catch the disease and have many complications. So immunization should be and must be recommended in the chronic cases, and which would be preventing them from these diseases at a very large extent.
Right. So now to wrap up, awareness start at home and families play a major role in prevention. So what is the role? What is one key message you would like to give it to the every Indian family about staying protected against hepatitis? So each of you, please do share one message. So we can start with Dr. Rajat. Your
So
message.
vaccine hesitancy is one of the major concern, which I think should be addressed at every routine visit, and we should be making patient aware about the missed vaccine or a new vaccine which is available, or whether the child has not completed any dose in past. So vaccine, and we have to reassure them about the safety and the efficacy, and that they provide a lifetime, long-term protection against the disease. So I think the pediatrician serves as a very important role in convincing the patients to get vaccines, and to address the vaccine hesitancy, which is one of the major cause for decreased vaccination.
Yeah. So Dr. Gaurav, could you please share your thoughts?
Sir, I fully agree with Dr. Rajat. Where one should play safe. So you should have a you should take proper immunization. You should have a good diet. Avoid junk foods. Avoid illegal activities, and definitely immunize. Your immunization will help you. So be educated and listen to your doctor. Yes.
Now, Dr. Saurav, thank you, Dr. Gaurav. So, thank you, Dr. Saurav. Could you please share your message to our
As the
parents?
other two doctors have already said, the first and the foremost thing I will say will begin at home. That will be good, clean water and sanitation, maintaining hygiene, which is primarily your own duty. So maintaining hygiene is something which you have to maintain. You need to cook your food properly. You need to have access to clear and good water. You need to maintain hand hygiene before consuming any food. That is the most important aspect of your daily routine life. And obviously, this is to stop any form of exposure. But still, in spite of all these efforts, your child might still be exposed to the virus. In those cases, the most important thing is to keep your baby vaccinated. So in case if there's any exposure, your baby has already got enough antibodies to fight against them and not suffer from the disease.
So that's all we wrap up. So today, hope our viewers, we hope today's session was informative and valuable in spreading awareness on the need of hepatitis vaccination. Our special thanks to Dr. Dr. Rajat Agrawal, Dr. Gaurav Garg, and Dr. Saurav Sharma for sharing their time, expertise, and insight with us today. For those who would like to revisit the program, the video will be available on our official social media platforms. Please follow us in YouTube, LinkedIn, Facebook, Twitter, Instagram. Do like, share, and spread the word to many friends, relatives, and family so that the awareness on vaccine reaches and we can save the life. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. Thank you so much.
Thank you.
you.